All right, this is the third part of the Learning Plan 3 lecture, third and last part. We're going to talk about transitions in nursing. There are many transitions. What are transitions? A transition is moving from one stage to another. Duh, right? They happen all the time. You might be transitioning from one job to another. You transition from student nurse to graduate nurse to RN. Transition from single to married, from childless to child, from working to retired. Transitions you will always be transitioning. And a lot of transitions happen at the same time. In a few months, you will be transitioning from student to graduate nurse to employed. These transitions are going to come crashing on top of you. There are 4 types of transitions. One is called developmental, situational, health illness, and organizational. So what are those? What do those mean? What is a developmental transition? What's a situational? Developmental is a transition of developing. Situational is more like moving from student to nurse. A health illness transition, that's pretty obvious. And an organizational transition would be a new boss coming in and somebody buying your business. That would be an organizational transition. They can be positive or negative. Actually, the transition isn't positive or negative. It's your reaction to the transition. We can't control what happens to us. We can only control how we react to what happens to us. So if somebody comes in and buys your company, you can be grumpy, or you can say, let's go with it. On the job, they could say, we're going to switch to a new computer system. Oh, that's going to be a mess, right? But you can't control the change. You can only control how you react to it. So you need to focus on how you internalize each change that comes upon you and how you're going to demonstrate your acceptance of it. Role transitions can be very complex. Think of, as a student nurse, your progression from first semester to fourth semester, your clinical experiences. My guess is each semester, your clinical experience get harder, right? It's supposed to. That's a transition. It can be very scary, especially as you get toward fourth semester where you're taking care of very complex patients, or in a nursing home taking care of a large number of residents. It's complex. And those transitions, well, I would imagine you've seen students who didn't make the transition. Part of that is because there's something called reality shock. And reality shock is what happens when you transition from student to nurse. When you are no longer working with the instructor, but you're working on your own. The job expectations of the hospital or whatever agency employs you and what your instructor expects of you are usually not the same. This change, this difference, is the basis of reality shock. Now think about that. Think of when you're in the clinical site, what your instructor expects you to do, and then look at what the staff is doing. Are they doing the same things as you're doing? Are they doing things exactly as your instructor expects you to do? Probably not. Is that wrong? Maybe. Maybe not. But that change in expectation is what causes reality shock. It can be devastating to go from having an insulated, protected student nurse position to being all of a sudden you're on the floor. Here you go, have at it. That is scary. Some places will give you very long orientations. Most hospitals will give you 3 to 6 months of orientation period before you are released to be on your own. Some facilities will give you very abbreviated orientation periods. I know of some long-term care facilities that give you about a week, and then you're the one. So how are you going to handle that? There are 3 phases to reality shock. The first is the honeymoon phase. Everything is wonderful. You're excited. It's all brand new and you're just really, you can't wait to get at it. It's just so good. Everything is wonderful. Every day you go in, it's just like sunshine and roses and it's just, wonderful. Until the shock and rejection phase hits in. And that's when you start having more bad days than good days. When bad stuff keeps flying at you. When suddenly it's no longer wonderful. Now, nothing maybe changed around you. It's just mentally you're realizing, this is the way it's going to be forever. That's where people have a choice. And you can do one of 2 options. And you have seen people on the job at this point. One way is you stay in a down phase where everything is negative and it's all bad. And you're just there just to punch a clock and get done. You want to do is the minimal possible, take care of as few people as possible, just get through the day in one piece. Burnout, right? Have you seen that? I'll bet you have. The other way is a recovery phase, where you've learned to adapt to this new reality with a sense of humor, a sense of reality, a decrease in internal tension because you've accepted what's going on. Now, how do you get to that point? The honeymoon phase, that's just boom, it's there. The shock and rejection is going to happen. How do you get to the recovery phase? You have to learn some prioritization skills. What's most important to get done? You have to deal with conflict management. There will be those people around you that are really negative. How are you going to deal with that? Because you'll have to deal with that. Time management skills are critical. You have, that much to do, and you have that much time. So you need to make sure you have good time management skills, and that's where prioritization also comes into play. And you need some support groups. Maybe peers, maybe a preceptor, maybe a mentor. And a preceptor and mentors are usually going to be different. Preceptor is involved with teaching you things and making sure you know skills. A mentor is somebody who is there to kind of be like that coach, that shoulder to cry on, maybe even a little bit of butt kicking to keep you on track. But they're not really teaching you skills. They're just giving you the emotional support to move on. Maybe you need external help. You might need actually professional help. There's nothing wrong with seeing a counselor. I mean, I'd rather have that happen than see a person absolutely break. But you need some people somewhere to be like your cushion, your support. Now, there are 4 groups that where people ineffectively resolve reality shock. 4 ways that, the positive resolution of reality shock is the time management, the prioritization, the conflict resolution, and support groups. That's positive and effective resolution of reality shock. But there's 4 ways of negatively resolving or ineffectively resolving reality shock. And one of them is the waves, we call them, just the waves. They're not content. They're not happy. They make waves wherever they go. They cause problems. They just You've seen them. Then there's the workday. They're just there to punch their clock and go home. Now, in one regard, there's nothing wrong with that. You are in the job, and you're expected to get paid, and you expect to get paid. And there is an aspect of that that's okay. But if that's your only purpose is to punch that clock, do minimal work, and punch out, that's not good. You're not giving everything you should. Then there's the niche workers. And these people are never in a spot where they're happy. They go to the med-surg unit, and they stay there for the 6-month minimum, and then they go to an ICU, and they stay there for the 6-month minimum. Then they go to women's health, or maybe they go to a community health agency. Maybe they go to a nursing home. They are just never satisfied because they're always saying, oh, that job over there, that job is the one that's the perfect job. Well, there's no perfect job. Is there? No. They're never satisfied. They're always looking for that better thing. And so they keep bouncing from place to place. Might they eventually find their spot? Maybe. Will they? Probably. Probably not. And then there could be just the eternal student, where they decide, let's go back and get that BSN. And then we're going to get another bachelor's in maybe business. And then we're going to get a master's. And then we're going to go to this school and go to that school. Because when you're a student, you have a protection around you. If you're a student, you're not expected to necessarily make the big bucks, make the big decisions, because you're a student. So those are 4 ineffective ways of resolving reality shock. Now, there's role transformation. And when does the transition of role, when does the role transition to graduate nurse begin? Actually, let me ask you something else. Let's change this for a second. When you're in the hospital and you have a patient, when do you start planning discharge for that patient? Yeah, you start preparing for discharge as soon as they get admitted. Well, you start transitioning to a graduate nurse the moment you take your first nursing course. That's just the way it is. When you start your first nursing class, you are beginning the transition to graduate nurse. Now, you are a beginner, and you are every semester getting better. You are transitioning closer and closer until finally you graduate. And at graduation, you know it all, right? No. You are an advanced beginner when you graduate. That's okay. Remember I said we're going to teach you enough to pass the boards and be a safe nurse? When you graduate and get hired in that first job, now you're going to learn how to be a nurse. But in that last semester, you'll notice that your instructors are going to your clinical instructors are going to back away from you more and more. They're going to let you fly a little bit further away on your own without us standing right behind you. No more mama management. We're going to give you a little more realistic patient care assignment. Maybe a few more people, maybe more complex people. We're going to expect you to perform instead of observe. We're going to put you in a real work setting. We're going to look for problem-solving opportunities to practice critical thinking. We're going to expect that you request constructive feedback. Sorry about that. If you are avoiding constructive feedback, to me, that's a signal that there's a problem. And you're going to start requesting experiences in the areas that you're interested in. So how can you prepare for that? Think positively. Seriously. If you've made it, or when you've made it to the last semester, you know some stuff. You're in the last semester. You've made it that far. So give yourself some credit. Be flexible. Understand that change is going to happen all the time. Get organized. have a plan of attack, understand priorities, stay healthy, get a good night's sleep when possible. I know students, you guys don't get much sleep. You need more sleep to be able to focus. And find a mentor. Find somebody on the job, in the facility working, or in another facility to use as a source of ideas. Adequately and honestly self-assess. Are you really excited about being a nurse? Are you open-minded? Are you willing to listen to new ideas? Are you comfortable with your basic nursing skills? Are you comfortable, putting on that gait belt? I mean, seriously, things as simple as that can really throw off a new nurse. Do you have a sense of humor? If you can't laugh at your mistakes, you're going to have a problem, because I'm sorry, you're going to make mistakes. I still make mistakes. And I can laugh at them, usually. You need to laugh at your mistakes too. Maybe not right at the moment, but looking backwards, you need to understand that we're human. Do you accept constructive criticism? Because, like I said, you're going to make mistakes. You're going to make med errors as a nurse. Things are going to go wrong. Can you accept feedback to point you in a better direction? Are you able to express your inner thoughts and feelings? That's really important, because if you can express what you're truly feeling, the people around you will be able to help you better. And maybe you'll be able to avoid burnout. That's a very common, popular term that describes a mental or physical energy depletion after chronic, unrelieved job-related stress. And it sometimes actually is expressed as a physical illness. People who have burnout, they may lose concern and respect for other people or respect for themselves. They frequently have a cynical, dehumanizing perception of people. A lot of times they'll label people. Oh, it's the pancreatitis. Oh, he's the schizophrenic. Oh, it's the hypochondriac is back. I've worked with those people. It's miserable to work with those people. What are some symptoms? Irritable, cynicism, angry outbursts, self-critical, and critical of others. Negative. There could be weight changes, up or down. Headaches, gastrointestinal disturbances, chronic fatigue, insomnia, depression, feelings of helplessness. What does that sound like? Depression, right? So burnout and depression are very close and probably exist side by side. Remember, we said get a support group. Get some peers that go with you that maybe know the same thing. Maybe you're a little bit ahead of you or a little bit behind you. Those ahead of you in time can say, come on, you'll make it. And those behind you use that honeymoon phase to keep you. Come on, it's going to be great. We're having fun, right? You need people with you. Otherwise, I don't want to see you burn out, but you will. And it's sad. It's just sad. Learn how to empower yourself. Self-care is really important. So what do you mean by self-care? You need to find a work-life balance. And everybody says work-life balance. But you have to do that. You can't be on the job 24/7. If you are, you will burn out fast. Don't overcommit. Learn, okay, I'm going to break the news now. Learn how to say no. No. You will be asked to serve on every committee under the sun. Say yes to some. Say no to the others. Pick and choose how you're going to spend your limited time and your limited energy. Serve on some committees. That's important. And the rest, practice saying, I appreciate the respect you have of offering me this option, but I cannot accept at this time because I'm already overcommitted or I'm at my level of commitment right now. You can follow up by saying, should more time become available, I would consider this offer at that point. Practice saying no. It's okay to say no. In your budgeted time, we all have the same number of hours a week, 164 hours a week. Some will be spent sleeping. Some will be spent working. Some will be spent eating. Some will be spent driving to work. Budget time for fun. Budget time for fun. You budget time now for studying, I hope. Budget time for fun. If you're married or have a significant other, put on the calendar every week or every other week or sometime, date night, that you can make sure that you know you're not going to be doing work. You're just going to be with the other person. My wife and I, we have an agreement that Saturdays are no school Saturdays. I don't answer emails on Saturdays. I don't grade papers. I don't read anything school related. At night, on no school Saturdays, we also have no phone Saturdays, where we put our phones down, we don't turn the computers on, we spend time together. Is that hard? Yes. Is it important? Yes. So, budget time for fun. Maybe budget some time for yourself. Just you. Even if you are married with kids and a little bit of time every day just for you. Maybe it's a walk. Get up in the morning and walk for a half hour. Maybe it's a massage. Once a month you go get a massage, or you go to the Y and swim. Whatever. Time for yourself. And cultivate friends outside of nursing. Now, we all like to go out and hang with our work crew Friday nights or Saturday nights or whatever, and that's fine, but what do you talk about? Work. Find friends that are not nurses. Let them talk about work for once in a while. And by the way, when you have friends that aren't nurses, your stories are more interesting because they've never heard them. So find those friends outside of work, and that'll be another support system. Maintain proper nutrition. Eat healthy. Maintain a good weight. Get good sleep. Quit smoking. Limit alcohol. These are all common sense and things that you already know, but it's amazing how many people know what they're supposed to do but don't do it. I'll take me as an example. Proper nutrition, maintain a healthy weight, obtain adequate sleep. I never smoked, so I already had that under control. When I was in the ER, I weighed over 300 pounds. Do you know how embarrassing it is to walk into a room, huffing and puffing, sweating, to tell a person who just had their heart attack, you need to go home, lose weight, and get more exercise? Hello, Mr. Pot, I'm Mr. Kettle. So I changed my whole life. I lost 120 pounds. It wasn't easy. It wasn't fast. I've maintained it for 28 and a half months and counting. Maintain a positive approach to life. Feel good about the future. Realize that the future really is good. You don't know what's going to happen. You control, to a large part, what does happen. Try to get rid of self-defeating beliefs. If you think there's no way I can, you're probably right. If you think, I can't pass this test, you're not going to pass it. Your mind will fulfill your beliefs. That summarizes this lecture. I hope that you're able to use some of these suggestions in school and after school to keep you fresh and focused and excited and happy. We need those kind of nurses out there because there are plenty of nurses who are otherwise. come back. I'm going to be talking, recording. As always, I look for feedback on these lectures. So shoot me any advice you have. I will also be recording a little quick talk about the discussion questions like I've been doing. So there's one more video you'll need to watch. And other than that, keep up the good work, everybody. You guys are doing a great job in the discussion questions, and I will talk to y'all later.